let's talk about secondary casualty survey. So when we do secondary casualty survey, we will focus, or we'll need to do the following. We need to check, the following in order to complete the secondary casualty survey. So we have the mnemonics sample. S for the symptoms. What are the signs and the symptoms that we see on the victim? A for allergies. Are there allergies? So we need to ask the victim if naa ba siya mga existing mga allergies. M for medication. Has the victim taken his or her medication, or naa ba siya maintenance medication nga wala niya, na skip niya og take on that specific day? P for previous health history. Has this happened before, or does this happen often sa victim? L, the last thing that was consumed or was eaten. Bag-o lang ba siya ning kaon sa o complete meal, or unsa nga fruit, or bag-o lang ba siya ning inom og medication, or bag-o lang bang siya ning drink og alcohol? So we need to also confirm what was the last thing that was consumed by the victim. And E for the events prior to the accident or to that incident. So, unsa man, what was the victim doing before it happened? Okay? So, unsa may gina-feel sa victim before it actually happened? Right? So, we will need to document everything. We need to know these sample. Okay? So, again, remember, always familiarize yourselves with the things that you need to check on the secondary survey. Again, S for symptoms, signs and symptoms. A for allergies. M for medication. P, previous history, previous health history. L, the last thing that was consumed by the victim. And E, events prior to the accident or the incident. Now, let's move on to the last step of emergency scene management, which is your ongoing casualty care. So what is ongoing casualty care? This is the care provided until you hand over or place the victim in a recovery position. Ongoing casualty care, meaning the medical team has already taken over and the victim is already placed in the recovery position. Now, what is the recovery position? This is the best position assumed by the victim, no? Because you can see both the front and the back portion of the body. So if there are injuries on the front and the back portion of the body, the anterior and posterior portion of the body, then it will be very visible once you place the victim in the recovery position. So this is how you do the recovery position. So first is you place the arm closest to you at right angles to the casualty's body with elbows bent and palms facing forward. So just this way. So arm is abducted, elbows flexed, no? And the elbows, the forearm is actually in a supinated position. Okay, palms facing up. Now, next is you cross the other arm over the casualty's body and hold the back of his hand against his cheek nearest you. So this one. So while the arms are flexed on the opposite, the arm nearest you, the arm must be abducted, elbows flexed, okay, and the palms facing up. While the opposite arm will be crossed over the body, and then hold the back of his hand, the posterior portion of the hand, against the cheek nearest you. Right? And then the lower extremity, you grasp the far leg. So you grasp the far leg above the knee and pull it up so the knee is bent. So you'll just have to bend the knees farther to you. So, and then pull the leg towards you so the casualty is now lying on his side facing towards you, making sure the casualty's airway is open, and check his breathing regularly until the emergency team arrives. Okay, so let's say, for example, you're already informed that the emergency team is coming, so make sure that the patient is already in the recovery position after doing the sample, checking the sample, no? After doing the primary and the secondary casualty survey. Now, What are the signs, no, when it comes to being unresponsive? How will you know that the victim is unresponsive? So these are now the signs. First is casualty does not respond to voice or touch. So when you touch the ears, when you pinch the ears, no, the casualty doesn't respond. When you talk to the victim, there's no response. Tapping the victim, there's no response. So, or another is decreasing consciousness. At first, the patient is still conscious, but then suddenly it's gone. Now, indicates the casualty is already getting worse. No, the situation is getting worse. The injury is becoming severe. Okay? So, mo na siya. So, you will know once ma-unresponsive, once ma-unconscious na gani si victim, this is already a serious situation. Now, you need to get help immediately. May result in an airway emergency. Possible that we have a problem with airway. Something is obstructing the airway. The patient is not able to breathe properly. And again, this is always a serious emergency situation. Call help immediately. Now, when we talk of fainting, no, this is a very common case, no. I think most of us has experienced this before. Kanang hapit na tamakuyapan. Okay, so may very common cause kung kanang mamro tagkakuyapon. Possible that there's overcrowding, daghan kayong tao, no, init, and then so that's why muratag makuyapan, or wala ta naka-eat og breakfast, diba? You're so stressed, kulang ka sa tulog, wala kay kaon. Then when you go out, no, and you're exposed to heat, ana, and then isa sad is anxiety. Isa sad na nga maka-cause of fainting. Now, definition, temporary loss of consciousness resulting from a shortage of oxygen to the brain. So, simple explanation for fainting, meaning the brain lacks oxygen. Kulang nag-oxygen si brain. That's why we feel weak, mangluspad na ta, di ba? Katong ganina, perfusion, how you check for the oxygen level of the victim. So you will notice that the lips becomes pale, the hands become pale, ingon ana, and then when you do the capillary refill test, no, it takes more than 2 seconds, no, for the color to come back sa nail beds. Okay? Now again, causes fear or anxiety, di ba, mahadlok ta, let's say naka-witness ta og accident or naka-witness ta og something hadlok kaayo, then yeah, pwede ta makuyapan. Severe pain, okay, especially for those who have serious illnesses or conditions, no, to a point na since it's very painful, ma-unconscious sila. Underlying illness, long periods of standing kana. So kanang magnovena, di ba? Experience that. Magnovena ta sa Santo Niño, or let's say for example, nagline mo because you need to process something. So daghan kaayo na makuyapan. Now, lack of fresh air, kulang sa hangin, overcrowded parades, ingon ana concerts, no, mag-stampede, ingon ana. So lack of fresh air. Fatigue, kapoy kaayo, overwork na kay ka. Grabe na kakapoy. Then to a point na mo faint na ka. And of course, very common is hunger. Kulang, hypoglycemia, lack of sugar. Okay, lack of sugar sa ato ang blood. So that's why, no, possible that we faint. So that's why for those diabetic na if they're taking maintenance medication, you need to make sure that when they go out, they need to bring with them candies, biscuits, no, anything that they could take in, no, ilakaunon. That way, once when they feel nga medyo malipo nga sila, medyo kakuya po na sila, so they could just take in candies, no? Or even they would drink sodas, just to increase the sugar level. Now, what are the warning signs of fainting? Of course, paleness, mangluspad na, mamugnaw na ang singot, nausea. Nausea is kanang mura kag kabuhion, ay mura kag kasukaon. Lightheaded, wa na. Gaan na kayo ang ulo, and then you could not stand steadily. No, a balance is already affected. So those are the warning signs that you are now about to faint. What's the first aid of fainting? So first is proper positioning. So if you are in a crowded area, then make sure nga hawa sa, no, you can actually move the victim or the casualty adto sa kilid. An area nga wala kay crowded, dili crowded, walay tao, walay mga marites nga maglantaw. Okay? So Position them properly, palingkuron, padukoon. Okay? Or paypayan. Ensure fresh air supply. Reassure. Because once dili siya ma-reassure that he or she will be okay, the more anxious the victim will be. Unang musamot na hinuon ka, no, ma-unconscious na hino, to a point nga ma-unconscious na. And then look for rapid improvement. You check the vital signs every now and then. You check the color of the lips, you check the pulse, no? Okay na ba? Normal na ba ang pulse? Normal na ba ang breathing? So you look for rapid improvement. So this is how you manage fainting. So this is all about emergency scene management. So I hope you learned something, and we will now then move on to our next topic on our next video.